you have to have a due diligence program. And the due diligence program is really for the owner, the pharmacist, and the pharmacy technician to truly understand what DEA is looking for. That due diligence program entails the looking at the doctors. Who are your prescribers? What is their education? What is their board certification? And those areas. There's nothing worse than in New York, which I do a lot of pharmacy inspections and a lot of presentations in New York, when you get a cardiologist writing a prescription for oxycodone 30 milligram, and the question is, all he knows is cardiology. Or better yet, how about a pediatrician who is writing a prescription for oxycodone 30 milligrams, 180 tablets for a patient who's 40 years old? Or how about an OBGYN doctor whose prescription is for a male 25 years old, and it's oxycodone 30 milligrams. And those type of prescriptions and that type of scenario is the ones that really should be part of your due diligence. With respect to your patients, you got to know your patients. You got to know what their problems are. If they have cancer and they're getting high numbers of opiates, and are they patients your local patients, or your patients coming from 100 miles and passing 200 pharmacies just to come and see you? I can assure you one thing: it's not the service that you're providing. There's two statements that I always used. I used it when I was at DEA, and I use it with you. Willful blindness and deliberate ignorance is two words and two phrases that is used by DEA when they're taking an action against a pharmacy. And what is important is that a pharmacist needs to have a due diligence program and explain the due diligence program when they're doing, when DEA is in their pharmacy doing an inspection and an audit.